Welcome, everybody. My name is Renee Schmiel. I'm the digital content producer for the University of New Haven. I am joined now by Dr. Summer McGee. She is Dean of the university's School of Health Sciences. She's also an expert on health policy, healthcare, bioethics, and we're going to be talking today about the slated reopening, phase one reopening of the state of Connecticut for May 20th. And that's going to be some businesses like restaurants. And Summer, just to start off, what's the latest? What should people know right now?
Well, I think the latest is that we still are day by day in the state of Connecticut, as well as around the country, monitoring the health conditions to ensure that it in fact is safe to reopen. So we're carefully monitoring new cases as well as hospitalization rates to make sure that it actually will be safe and that the level of the virus spreading in our community continues to decline so that we know that it will be okay to resume some normal activities after May 20th.
And what we've been seeing so far with all this checking, is the state ready to reopen in your opinion?
I think some of the conditions that are necessary to reopen have been met. We are seeing declining hospitalizations every day. We're seeing declines in death rates. And we have seen an increase in testing, which I think is very good. I think most experts would say, including our governor, that we don't yet have enough testing to be able to fully reopen our economy. And so this will have to be very much a phased process, step by step. And right now, the real limiting factor in being able to open our economy more aggressively seems to be access to testing, and more specifically, access to the materials and items we need to do testing, like nasopharyngeal swabs that are necessary to perform the test.
And what are some of the ethical concerns involved with testing in terms of who gets tested, in terms of who pays for testing?
Yeah, so there's a lot of issues around testing. And even when we say the word testing, are we talking about viral testing? Are we talking about antibody testing, which is still very new and not totally known to be effective yet? So I think there's a lot of questions out there about testing. How do we ensure enough access? How do we ensure that particular communities that maybe don't have regular access to cars and transportation have access to tests in their communities? Because we want to be sure that everywhere around the state, people have adequate access to testing. I think employers need to take on a big burden of this and provide and ensure access to testing for their employees as they reopen. And that's a huge expense. And so I think one of the things that our state is currently grappling with is who will pay for this testing and how will it be paid for. And I think those are things that we're actively still working on, but still moving toward trying to reopen as soon as possible.
And with this reopening, what might this look like? If somebody, say, goes out and goes to a restaurant after this date, what would they be seeing, do you think?
So I hope what they're seeing is that everyone that they encounter, whether it's a restaurant employee or the patrons at that restaurant, will be wearing masks. That is a requirement for going out into public. I hope that they will also see that people are physically distancing. And I think that a lot of businesses, restaurants and stores are really trying to come up with creative ways to still be able to provide service and yet maintain social distancing, right? So even the normal practices of a wait staff person brings and puts your food onto your table, maybe will need to be modified, right? Maybe you'll need to go pick up your food yourself and those kinds of things, just to try to minimize contact within some of these restaurants and spaces. So you're definitely going to see reduced capacity in a lot of restaurants and stores, and hopefully everyone will continue to physically distance and wear masks.
In what ways do you think technology might be used to enforce social distancing and to reduce contact between people?
Yeah, so I think there's a lot of creative things that we can do using technology. I mean, right now the state is recommending using an app called How We Feel to monitor our symptoms. There are new contact tracing apps that are coming out that will allow for people to know whether they've been in the proximity of someone who has tested positive for COVID-19. I think there's a lot of tools that are rapidly emerging that are going to help us know Where are cases increasing in certain communities? Maybe those are zip codes or areas to avoid. Maybe don't go to a restaurant in a zip code where we see cases are increasing or people are reporting that they're sick. So I think those tools will be able to help us in time. But again, the most important tool we have is staying home as much as possible. I think that's something that people are thinking, well, the economy is going to reopen on May 20th. Everything's going to be operating at least 50% capacity or less. And really the state is strongly encouraging people that if you can continue to work from home, to continue to do so until we can see if we can get through this initial phase of reopening safely.
And when we talk about contact tracing, what are some of the ethical concerns involved with that, involved with people's privacy, say?
Yeah, contact tracing is inherently invasive on people's privacy. You have to share every person you've been in contact with, when you were in contact with them, where you were. And so it requires people to have a lot of trust in the person that they're giving that information to, whether that's your employer or a local public health official. And so I think that's something that will be very new for a lot of Americans, to share that private information about where they've been going and who they've interacted with. But it really is an essential public health function that will allow for us to identify cases and isolate people faster. And so I think whether it's doing it through an app or whether you're talking to a person, being truthful and being candid about where you've been and who you've been in contact with and getting that testing is really going to help us keep the number of cases from exploding as we open our economy.
And looking ahead a little bit, because of this, what impact do you think this is going to have on how we treat healthcare information and privacy going forward?
I really think that we are going to be willing to share a lot more about our health conditions and about what we are going through and whether or not we've even been exposed to COVID or not, right? And I think as antibody testing becomes much more common, I think people are going to be willing to share and say, yes, I've had COVID-19, I've got antibodies, it's okay to be around me, I'm not a risk to you. Whereas we don't typically share that kind of information. We don't talk about our hypertension or our diabetes over the dinner table or with friends. I think this is going to really change how we think about sharing our diagnoses and our risk factors, and that will be much more open. And I think we have to be, whether it's with our employers or with our neighbors, as a way of protecting ourselves and protecting others from the potential risks that COVID-19 has in store for us.
And again, looking ahead to this reopening, is there anybody who perhaps shouldn't be going out when this does start?
Yeah, I think the CDC has a long list of people who are considered at high risk if they were to be exposed to COVID-19, that you're more likely to be hospitalized or to die. And that includes older individuals, anyone over the age of 65. It includes people with chronic conditions like heart disease, liver disease, kidney disease, respiratory conditions, and autoimmune conditions. So that's a lot of different groups of people that really should think carefully about whether they want to return to work anytime soon. Obviously, if they can remote work, I think that will be encouraged, and they should take even more precaution to ensure that they don't get exposed to the virus.
And if other nearby states are not having a reopening like this, what challenges does that pose?
Well, as we know, particularly here in New England, all of our states are very close together, and we're kind of one continuous community, right? And so it's just as important what New York decides to do. For us here in Connecticut, as we've learned, our proximity to New York was a large reason why we had so many cases here in Connecticut. And so I think we really have to take even more of a regional approach and work together and be mindful of, particularly here in Connecticut, we're right in between two very large metropolitan areas that have been very hard hit by this virus in Boston and New York. And so I think we have to look at this with a broader perspective and take into consideration the conditions in other states, because we do so easily travel across state lines. And as we know, the virus doesn't acknowledge any state borders. It just goes wherever people are. So I think we all have to work together to keep everyone safe.
And let's say this phase 1 does go well on May 20th, and after that, what could a possible phase 2 be looking like?
So I think in phase 2, we'll see more businesses opening, more people returning to work. I think increasing slowly over time the capacity of things like restaurants. We may see that some outdoor, youth sports and other activities can commence. And hopefully we'll be able to open schools, universities, as well as secondary schools and primary schools. I think those are all things that should come in a very stepwise approach. If we're able to do this well on this first round, that over the summer we can continue to relax those restrictions and hopefully get back to some sort of a normal life by this fall. But I think it's very important that we continue to monitor very closely those key indicators of hospitalizations and cases. And if we begin to see those going up, then we know we've gone too far and we need to pull back and perhaps continue to stay at home and minimize our actions and our business that's currently underway.
And on that note, there has been some concern about a possible second or even third wave of the virus. Do you think reopening such as this could have any impact on that?
I think it absolutely will. And I think we know that by opening our economy and resuming normal activity, we will see some increase in cases, right? It's just a given. I think the question is how much. And so whatever we could do to keep that second wave of being more of a ripple rather than the tsunami of cases that we just saw, I think that would be really important and an important win for us. And so if you look at the history of epidemics, if you look at everything from the flu pandemic that we had in 1918 and 1919, there's always been a second and a third wave. It's just a question of how big that wave is and how many people does it impact. And so if we've learned, and we have learned a lot about what to do to protect ourselves against this virus, I think we can minimize the impact of those secondary and tertiary waves that may be coming.
And to wrap up, what's your takeaway for people as we're looking ahead to this phase 1 of the reopening? What should people know? What's the most important thing?
I think the most important thing is to remember, as eager as we all are to get back to our hair salon or back into our favorite restaurant, that we're in this for the long haul. And so I think if everyone rushes out on May 20th and runs into all of these businesses and doesn't social distance and don't wear masks, we're guaranteed to have another big spike in cases. So I think we have to be patient and remember that as important as opening our economy and resuming normal activity is, our public health is much more important. And so we need to take this very cautiously. But I think we can do it if we continue to do the things that work, like social distancing and other public health measures. So I think it's an important thing to remember that life isn't going to get back to normal overnight, but if we do it well, we can get over the next few months closer and closer to something like normalcy.
Thank you so much. We appreciate it.
Thank you.